would like to share with you um, a few slides that I think are important to understand diabetes. So for most Asian Indian Americans, as we can see, that diabetes is the highest amongst any other ethnic race that you can actually see. Um, and there are several reasons behind that, which I will come to. But Filipinos also follow somewhat right behind us as well. And this is actually in the Bay Area. It's from Palo Alto Medical Foundation. And it talks about people in California, where we notice that Indians are fairly high in women as well as in men, and just after Filipinos. So the rest are all then lagging way behind. But it is very important to note that our ethnicity has a great propensity to develop diabetes. Now, we know about the myths of diabetes, but what we want to understand is how do we know that we're going to get it and what makes us prevent it from getting it? After all, you can only prevent something if you know what it is and what you need to do about it. So the pancreas is an organ that's in your tummy, and it's quite right in the center. And what it does is it produces insulin. And it also produces another hormone called glucagon, which is the opposite of the work of insulin. But essentially, insulin is what brings glucose levels down. And it's very, very important. So if you don't have a pancreas, essentially you behave like what we call a type 1 diabetic, who essentially needs insulin to survive. But a type 2 diabetic has their pancreas, which may not be working to the extent that we want it to work. And what is insulin resistance? Is the insulin is required for glucose to enter into the cell. It is essentially your key that needs to fit into the keyhole. Now, if you have a diet that is so full of triglycerides and full of fat food, it generally clogs up this area and doesn't allow that key to enter, which leaves all this glucose floating around in the bloodstream, causing all its damage. And the more and more insulin is required to overcome that glucose to enter into this cell. And that's what we call insulin resistance. You need glucose to go inside so that it can be going to the liver, to the muscle, to the organs, in order so that it can be used properly in order to make energy. Now, you can have insulin resistance if you're fat. You can also have insulin resistance if you're thin. And the way we look at it is, where does that fat go? So if you're the shape of a pear, or if you're shape of an apple, we're not going to be derogatory to anybody or make anybody feel bad. But essentially all that we're trying to say is that the abdominal fat that collects, or the central obesity that collects right in the center, collects what we call visceral fat. And that fat goes around all your organs and causes damage and leads to diabetes, high cholesterol, high blood pressure, etc. Whereas if you're more of a pear structure, which most South Asians are pears and most women are pear structures, they do not have as great a propensity to develop diabetes. That doesn't mean that they don't get it at all, but the risks are lesser. So when we talk about people who walk into a clinic, especially people who come in to see me, the first thing they say is that I was diagnosed with diabetes today. Well, I don't think you're not diagnosed with diabetes today. You were diagnosed with diabetes many years ago. The time of diagnosis is here when you walk in, but actually you were diagnosed maybe 5 or 10 years ago when your glucose levels had already started to rise. And so the first rise that you see is actually after meals. And that's all coming from insulin resistance, as you can see in the lower chart. And all this depends on what we call the beta cells. So the beta cells come from that pancreas that I showed you earlier to release insulin. And the beta cells, they fall as you start developing diabetes. And by the time you're diagnosed with diabetes, you've lost 50% of them already. So if you don't take care of them further, by losing the weight, taking care of oneself, one will develop more and more insulin resistance, higher glucose levels, and all the damage that occurs from it. So there are 8 risk factors of diabetes. Some of them were talked about prior. As we get older, maybe above 40, you could be even younger, um, more the inactive lifestyle, your high cholesterol, high blood pressure, a BMI above 23. And I'm saying this 23 is because Asian Indians are obese, are considered obese at a lower BMI as compared to Caucasians. So even if you were to be 25 or 26, you would be considered obese. And so you want to have a very low BMI. Your family history, of course, is something that you really can't change, but you can change all of the other factors that are right here. We talked about the intermittent fasting. We talk about a whole food plant-based diet, talk about eating 3 healthy meals, exercising. Exercise is a big component that will help you to bring down diabetes and pre-diabetes. There is one topic here which we haven't alluded to, and that's gestational diabetes, that is diabetes in pregnancy. If a woman had gestational diabetes, her chance of developing diabetes later on is about 50%. So it's very important that to lose the weight that one gains during pregnancy, to try and come down to that maternal weight. And if, especially if there's a family history, to keep a watch on your sugars, check your blood sugars, monitor them, and look for levels of glucose that might be elevated in order to prevent what's coming your way. Prevention is a lot easier than when you actually get it and treating it, because then you're already causing so much amount of damage.